Hi guys, I am Ahmed and are you looking at this picture? Have you ever done binge eating? Do you feel guilty after that? I hope you have not opted purging after that. If you have done this or if you have come across such patient ever, then today's topic is for you. Otherwise, this topic is must for you because this appears in exam multiple times, and all these MCQ I'm discussing today are from same topic, but they are from three different papers. So it means this topic comes often. Let's discuss and see what is this. A 20 years old female brought with her mother complains that her daughter vomiting in last 3 months every day at night. She also found half used bottle of diuretic tablets in her daughter room. Her BMI is 29. There are calluses over his, not his, it should be her metacarpophalangeal joint. To which department would you refer her? In next question we will see what is the diagnosis of this, but so far this is a psychiatric disorder, eating disorder basically. So you will refer, or we will refer her to psychiatry department. There is no clue that it is a neurological disorder. There is no clue that it is a musculoskeletal or endocrinological disorder. So we will check in next MCQ what is it, and then we will be sure that we will refer her to psychiatry department. Question number 20 is the same question. 20 years old female brought by her mother, complains of vomiting every night for 3 months, found half used bottle of diuretic in her room. BMI is 28.8, menstrual cycles are regular, keratosis over her metacarpophalangeal joint. What is most likely diagnosis? Anorexia nervosa, bulimia nervosa, obesity complication, pyloric stenosis. Okay, is it anorexia nervosa? Anorexia nervosa is eating disorder, but in that there is weight is below normal. Okay, here weight is a little bit above normal, and there are usually menstrual complications in that, and there is diet restriction in that. That is not mentioned in this question. So this is not anorexia nervosa. This is bulimia nervosa. Yes, this is bulimia nervosa. We will check why this is bulimia nervosa. We will discuss the topic in short. Obesity complications. Is she obese? No. BMI is 28.8. If it is 30 or above, we will say she is obese. No, she is just little overweight, not obese. So if she is not obese, then obesity complication is out of question. Pyloric stenosis. This is usually infantile disease. It appears early in life, and due to pyloric stenosis, there is stunted in growth, persistent vomiting. Vomiting will not be at night only. She is 20-year-old. It's very rare at that age. Okay, and of course, pyloric stenosis is not associated with use of diuretics, and in that case, weight will definitely be below normal. So this is bulimia nervosa. And what is bulimia nervosa? Bulimia nervosa is an eating disorder. It is more common in young females, okay, just like our scenario. Weight is usually normal, but it may be slightly raised. But patient will never be obese, and patient will never be underweight. Menstrual issues are uncommon. Binge eating is there, but there is no diet restriction. Okay, there is no food restriction as it is written in the last sentence. There will be, after binge eating, there will be guilt and anxiety, and most of the time there will be self-induced vomiting, and there will be history of use of diuretics and enemas and laxative just to overcome that guilty. So all these features will lead you to the diagnosis of bulimia nervosa. So this was bulimia nervosa. We will go to next question and discuss. This is about the same topic. 20-year-old female brought by her mother, vomiting every night for 3 months. She also found half-used bottle of laxatives in her daughter room. Okay, here you check. In last question it was diuretics, it makes not much difference, but in exam, if the again same scenario coming, do read it again. Sometimes there are some one or two different words, and that may lead to some different thing, but that is not the case in this question. She has regular menstrual cycle, she has keratosis over metacarpophalangeal joints. Considering your most likely diagnosis, which of the following is appropriate drug to start with? All these three questions were in the same paper. Okay, as I told you earlier, in some exam it may happen, and it is happening, that for the same scenario they will ask you 2, 3, even 4 questions. Okay, so we have considered that the diagnosis is what? Bulimia, yeah, bulimia nervosa. So out of all these four, which is the most appropriate drug to start with? Olanzapine. Olanzapine is antipsychotic. Okay, we will go with actually SSRIs. Okay, but and olanzapine again is not drug of choice, because it will the side effect of, or adverse effect of it is weight gain. Patient is already very concerned about her weight, so we will not start a drug that will increase her weight. Okay, fluoxetine. SSRIs are drug of choice. Okay, and especially fluoxetine, there are studies on fluoxetine that it has positive effect on bulimia nervosa. So we'll start her on fluoxetine. And in studies even, you know that SSRIs and fluoxetine are antidepressant group, but the effect of fluoxetine on bulimia nervosa is independent of that effect. Alprazolam is anxiolytic, and that is not drug of choice or even drug of consideration in these. Propranolol is a beta blocker that is used in many diseases where you can use beta blocker, like ischemic heart disease, angina, hypertension. It is used also in hyperthyroidism, and it is also used to control the peripheral effects of anxiety. But here you don't want to control her peripheral effects of anxiety. This is straight away bulimia nervosa, you will go for fluoxetine. So drug of choice here is fluoxetine. Okay, we know all three options are not correct. Okay, go to next question. We have some more treatment options. Sorry, we will discuss treatment options of bulimia nervosa. Okay, remember all these options, because sometimes question may appear little bit different. You have to educate the patient and family support. This is for all diseases almost, this is true. You have to do CBT. CBT is what? This is cognitive behavioral therapy. Okay, in this there are many methods, and you try to improve her cognitive function about her disease. IPT is interpersonal therapy. This therapy is usually based on interpersonal relationships and social working of the patient. SSRIs, especially fluoxetine, this is, if you want to go for drug, this is drug of choice. CBT is basically treatment of choice if they ask, because it has positive short and long term effects. And if the patient has electrolyte imbalances or long term due to long term vomiting issues, she has dehydration, then you can go for IV hydration and other supportive therapy to improve the electrolyte imbalances. So we will go to the next question. This is almost again the same scenario. 20 years old female brought with her mother, complains that her daughter vomiting in last 3 months every day at night. She also found half used bottle of laxative in her daughter room. Her BMI is 28.8. She has regular menstrual cycle. While examining her after your provisional diagnosis of bulimia nervosa, these physical signs you can expect to observe, accept. Okay, in simple, if there is a patient of bulimia nervosa, all these signs will be there except one. Okay, so 3 are correct and 1 is wrong, and we will choose the wrong option. Pitted teeth. Pit means, is just like a hole you dig in a soil. So there are pits in the teeth, and this is a feature of bulimia nervosa due to repeated vomiting, there is contact of teeth with stomach acid, and that stomach acid destroys the teeth enamel. Russell sign, as you have observed that in all sentences there was a sentence, in all questions, all previous three questions, there was a sentence that there is callus or keratosis over knuckles. This is called Russell sign. I was deliberately ignoring that, so we can discuss that sign here. So that is a sign of bulimia nervosa. On knuckles there will be calluses, okay, and there is parotid gland enlargement is there in bulimia nervosa, but there is no cervical lymphadenopathy. So all three options are there in bulimia nervosa, but cervical lymphadenopathy will not be there. So D option is correct. Okay, you will remember the sign Russell sign. Russell sign. What is Russell sign? Very good. Come near. Good. Russell sign is calluses over the knuckle. Okay. Other sign you will remember definitely, inshallah. 20-year-old female brought with her mother complains that her daughter vomiting in last 3 months every day at night. She also found half-used bottle of laxative tablets in her daughter room. Her BMI is 28.8. She has regular menstrual cycles. Diagnosis bulimia nervosa. In lab investigation, what is least expected finding? Okay, so this is about electrolyte imbalance and acid base imbalance. Hypokalemia, hyperkalemia, metabolic alkalosis, metabolic acidosis. Hypokalemia will be there, yes, due to repeated vomitings, potassium level will be low. Hyperkalemia, no, there is no mechanism that can increase her potassium, so correct option here is hyperkalemia, but we will check other two options. Metabolic acidosis, due to repeated vomiting, there will be loss of acid from stomach, so loss of acid means pH will increase, and that is metabolic acid alkalosis. Metabolic alkalosis will be there. Metabolic acidosis, interestingly, metabolic acidosis can also be there due to laxatives. Okay, laxatives will cause increased stools or diarrhea that can cause metabolic acidosis. So option A, C and D are correct, and as we have to choose the wrong option as most likely option here, so hyperkalemia is the correct option. That will not present in bulimia nervosa. Okay. Electrolyte imbalances, as we have already discussed, hypokalemia will be there due to repeated vomiting. Hyperchloremia will be there also due to same mechanism. Metabolic alkalosis will be there, you know why, due to loss of acid in vomiting, and metabolic acid will be there due to, yes, laxative abuse can cause metabolic acidosis. We will discuss in detail acid base imbalances in some other question. Here it will take much time in discussion. Soon we will discuss it in detail. Okay, this is again the same scenario. 20-year-old female brought with her mother complains that her daughter vomiting in last 3 months every day at night. She also found half-used bottle of laxative tablets in her room. BMI is 28.8. She has regular menstrual cycle with the diagnosis of bulimia nervosa. All of the following are its complications except. So it is about systemic complications of bulimia nervosa. Okay, all of these can be present in bulimia nervosa except one. Arrhythmias, yes, cardiac arrhythmias can be there, and mostly they are due to electrolyte imbalances, especially potassium, low potassium. Renal complications like renal stone, and sometimes if it's long standing, there can be uremia also. Angina will not be there. There is no mechanism involved that can cause angina, so angina is the correct option here. As we have already discussed, electrolyte imbalances are there. Okay, remember the electrolyte imbalances. Such question can come in D option. You can see hypokalemia, metabolic acidosis or metabolic alkalosis. So question can appear a little bit different, but remember the correct options. Okay, so angina is not there, so we will choose angina. Complications. Definitely psychological complications are there. Electrolytes we have discussed. Can you tell me most common? Yes, good, good, good. Hypokalemia, hypochloremia, metabolic acidosis, metabolic alkalosis. Cardiac arrhythmias are there. Sinus bradycardia can also be there. Okay, not only tachyarrhythmias, ventricular tachycardias are common. Sinus tachycardia, even sinus bradycardia is also there. Renal complications, I have already told you. Uh, Renal stones, uremia, osteoporosis, long-standing eating disorder can cause osteoporosis, Mallory-Weiss tear. What is this? This is a small tear in stomach due to repeated and forceful vomiting. Okay, if the patient is doing again and again repeated vomiting, you can see this tear and even esophageal rupture. Mechanism of all these two complications is same, repeated vomiting, and when there is vomiting is forceful, the tear or rupture can happen. Okay, so remember, all these complications, they can come with a different scenario. Okay, last question I hope, or there is one more question, let me check. This is the question 25. A 20-year-old female brought with her mother complains that her daughter vomiting in last 3 months every day at night. She also found half-used bottle of laxative in her room. BMI is 28.8. Regular menstrual cycle. Diagnosis of bulimia nervosa. How much increase in her mortality rate expected after 5 years? Okay, the question is asking about what is the mortality rate, increase in mortality rate in bulimia nervosa. So there is no increase in mortality rate. Question, this is yes or no question, either you know it or no, not. So there is 0% increase in mortality rate after 5 years. You will choose first option, all other options are wrong. We have one more question. Yeah, this is the last question of the day, I hope so. Yes. 20-year-old female brought with her mother complains that her daughter is vomiting in last 3 months every day at night. She also found half-used bottle of laxative and some syrup. Okay, there is a change in word. They have added some syrup. Her BMI is 28.8. She has regular menstrual cycle with a diagnosis of bulimia nervosa. Use of which of the following can increase the risk of cardiomyopathy in this patient? Okay, this can be a question of pharmacology, but as it was associated with bulimia nervosa, so I have brought it here. Bisacodyl diuretic tablets, ipecac syrup, and bisacodyl tablets. Bisacodyl is used by these are all 4 drugs used by bulimia nervosa patients. Bisacodyl is not associated with cardiomyopathy. Diuretics have many complications but not cardiomyopathy. Ipecac or ipecac syrup, yes, it is a syrup to induce vomiting, and in past it was used in emergency as treatment of poisoning. But nowadays, with the increased use of activated charcoal, this is out of the scenario. This is not being used, and even before 2003 it was recommended that parents should have that syrup at home for accidental poisoning of children, but that is not recommended now. Continuous use of this is associated with cardiomyopathy, so it is out of most of recommendations now. Okay, so correct option is C. Bisacodyl tablets, again they are used as laxative and they are not associated with increase of cardiomyopathy. This was an interesting question and you should know about that. This was all about the bulimia. Weather is a little bit warm here and I would like to take leave for today. I will soon be with you with some other interesting topic, and do subscribe my channel so you can get my new videos early. I hope you like today's questions, and every day is important for you. If you have watched this video, kindly make the notes of these questions and this topic, and you can watch this video again. If you have any confusion, you can ask me anytime. See you again. Bye.